Today, March 4, is World Obesity Day. Today on the COVID-19 update, Health Minister Dr. Frank Anthony addresses the prevalence of the disease in Guyana and what can be done to reduce cases.
It's really important because we know that obesity is a risk factor for many other diseases. So it would increase a person's risk of dying early, so premature deaths. And it's a contributor to a number of diseases such as cardiovascular diseases, dyslipidemia, diabetes, for example. And as you're aware, we have in Guyana a lot of persons who would suffer from what we term as chronic non-communicable diseases. And therefore, obesity is really a risk factor for many of these diseases. With COVID-19, we have also seen that persons who are obese would be at a higher risk for COVID-19. And we have seen that in the global statistics, and we have seen that locally as well. So there's an increased risk if you're obese. One way of measuring this disease is to do what is called a BMI. BMI really is a body mass index, and it's defined as your weight in kilogram divided by your height in square meters. And so when you do that calculation, you'll get a number. Now, depending on what that number is, you can basically be classified in different categories. So you can have someone with a normal body weight, you can have somebody who is overweight, and an overweight person would have a BMI of somewhere between 25 to 29.9 kilogram per square meter. An obese person is defined as someone with a BMI of greater than 30 kilogram per meter square. And a severely obese person is one that would have a BMI of greater than 40 kilogram per meter square. Depending on where you fall in this spectrum, there are different things that can be recommended of how to prevent or reduce this. One of the main goals that people would set is to have weight loss. But if you just do, let's say, diet alone, maybe that would help you to bring down your weight by probably between 5 to 7%. If you do a combination of diet and exercise, you'll probably be able to get it down to about 10%. And it depends on, again, the categories that you fall in, if you're high risk, low risk, moderate risk, and so forth. So for each person, once you measure your BMI, you will then be able to get a sense of your risk, and depending on your risk, you can either consult with a doctor to know what are the measures you can take. So there are lots of measures that are available right now, diet being one of them. You have exercise, another, a combination of diet and exercise. In some cases, the doctors can recommend pharmacological treatment. There are medicines that are available. And in other cases, like in the cases of persons with high risk, one can also contemplate doing surgery. So there are a number of interventions, and those interventions you'll have to discuss with your doctor to know which one might be the most appropriate for you. So if you have one of the chronic non-communicable diseases that are associated with, or obesity that is associated with these chronic non-communicable diseases, at any one of those clinics, they would give you guidance and counseling about risk factors, which would include obesity, and what steps you can take to reduce that risk. And if you require dietary help, then another section of the ministry, the nutrition section, we very often provide nutritional information on what you can eat, when you can eat, how much you should eat, and how to prepare your meals. So we have a number of guidelines that we have developed, and we have been training people at different health centers to be able to provide this type of guidance. We have printed material, we have video material, and in some instances, the team from the ministry would go out into the community, go to specific areas, and they would do demonstration of how to cook these types of meals. So for diabetic patients, what you need to eat, for other types of patients, maybe for a hypertensive, you need a reduced salt intake. In other instances, to identify trans fats in your food so that you don't consume too much trans fats. So these types of educational programs, not just talking about it, but demonstrating how you can do it, we have been rolling out these programs across the different health centers so that people can be more aware. The hesitancy, it is a big problem, and among the obese, you would find persons who might have gotten misinformation, and therefore they're reluctant to come and get vaccinated. We have found in our vaccination program that although vaccines are going to be useful for many persons, the persons believe the opposite. So for example, maybe a person who has diabetes, they think that they shouldn't get the vaccine because they're diabetic, and that's not so. In fact, because of the risk that you have, a high risk of getting COVID, then you should go and get your vaccines. As of yesterday, we would have completed 433,497 doses for adults. That's about 84.5% of the adult population. And for second dose, we are now at 330,026 doses. That's about 64.3% of that population, the adult population. For persons between 12 to 17, we have administered 33,661 doses. That's 46.2% of that age cohort. And second dose is 24,373, or 33.4% of that age cohort. Booster doses have been going up incrementally. So we are now at 51,925. And again, we just want to appeal to people and to encourage people. If you're eligible for a booster dose, please come and get yours.
You have been watching the daily COVID-19 update for today, Friday, March 4, 2022. I'm Natasha Smith-Thomas. Goodbye.